Colorectal cancer is cancer of the colon and the rectum. The colon and rectum, collectively also known as colon cancers, occurs very frequently around the world. In the Singapore context, it has been estimated by the Ministry of Health guidelines that up to 2 in 100 people might develop colorectal cancer in their lifetimes. Okay, colorectal cancer usually affects people in the older age group, and that is the reason why the Ministry of Health has recommended colorectal cancer screening for people above the age of 50 years old. Colorectal cancer can also come through genetic causes. For example, with people with strong family history of colorectal cancers, or they have strong history in their families of inflammatory bowel diseases like ulcerative colitis or Crohn's disease. So these two groups of people are a bit more prone to colorectal cancers. 90% of colorectal cancers come from spontaneous mutations in their lining of the colon, and 10% of colorectal cancers come from genetic factors like I've mentioned before. Okay, usually colorectal cancers come in the older generation, but there's growing evidence that even the younger generation are having higher and higher colorectal cancer rates. Why does cancer come on? Colorectal cancer is usually caused by a variety of factors. These factors would include a sedentary lifestyle, where the person doesn't exercise regularly, a high-fat diet, and a low-fiber diet. Other factors like environmental factors, including pollution, may also play a role. These are factors above and beyond the genetic factors that I've mentioned for patients who have early colorectal cancers. Investigation of colorectal cancers would include blood tests, which includes a CEA levels, which is a cancer marker specific for colorectal cancer. Scans, which will include a CT scan, which can show the large colorectal cancers or even spread for colorectal cancers. But most importantly, an endoscopy, more specifically a colonoscopy. This is a flexible tube that is placed through the back passages that can look at the entire colon and rectal area. Then when we do find any unusual findings during the colonoscopy, we can do tissue sampling or biopsies, and if the lumps are small enough, we can actually remove them. Surgery is usually the best treatment for colorectal cancers, and this can be augmented by chemotherapy and radiotherapy. The most important factor in surviving colorectal cancers is picking the cancer up early. Stage 1 colorectal cancer has an almost 95 to 99% survival rate. Colorectal cancer survival or success of colorectal cancer treatment depends on the stage of the cancer, which in other words, it means that the earlier the cancer you pick up, the higher rate of survival. Colorectal cancer picked within the first and second stage of colorectal cancers have very good survival rates, but once you reach stage 3 and stage 4, the survival rates drops dramatically. So picking up the cancer early is very, very important.